Well, different types of doctors, different specialties have different salaries. Also, depending on a doctor's employment situation, doctors are paid a little differently based on who their employers are. For instance, if a doctor is employed by a hospital, she generally gets paid regardless of how much money she generates to the business, the hospital. That's because the hospital is contractually obligated to pay her. However, in private practice, owned by the doctor only gets paid when there is money left over and after business expenses have been paid, basically just like running a small business. In this video, we first consider how doctors employed by hospitals are paid. As with all of our videos, remember that one size does not fit all, but that these compensation fundamentals and formulae do occur throughout the United States, regardless of where you live. Generally, hospital-employed doctors are paid a fixed salary or some sort of hybrid based on production. For instance, the number of patients seen and/or other measures. Since the early to mid-2000s, doctors employed by hospitals have been paid, at least in part, via a Work Relative Value Unit or a WRVU. RVUs are another story for another time. All of the work that doctors do can theoretically be measured, so a surgeon might generate 12 to 15,000 RVUs in a year by performing surgeries. Each surgery has a work value associated with that procedure. As such, the hospital might pay her a fixed dollar amount for each RVU generated. Let's say Dr. Susie performs enough surgeries to generate 12,000 RVUs. Her contract with Hospital X states she gets paid $50 per RVU, so she would get paid $600,000 for performing the number of surgeries required to generate 12,000 RVUs. Now, if Dr. Susie produced 15,000 RVUs, she would receive $750,000 for her efforts. These days, some hospitals pay doctors for different outcomes and not only production. For instance, Dr. Susie might make $40 per RVU for performing surgeries, but she receives an extra $25,000 for quality that the hospital wants to incentivize in surgical outcomes and another $25,000 for operational efficiency, such as saving the hospital health system money. So her total compensation in this example would be $530,000. Many of these pieces are malleable, meaning the hospital can put more weight into components it values more. For instance, if they want Dr. Susie to perform more surgeries, they might offer her more money per RVU and a little less in the efficiency category. Also, it's worth knowing that there are legal constraints to these pay arrangements, but we won't dig into these here. Hospitals use different methodologies to incentivize doctors to be productive. Whether that's the right or wrong approach is a matter for discussion, but there are varying ways to financially reward doctors for their work. At Cubed, our goal is to educate consumers and offer a broad picture of what some of these compensation arrangements might look like. These videos are not meant to answer all questions precisely. There are simply too many compensation plans throughout the country. But these compensation videos are directionally accurate across the United States. Just remember, some nuance exists geographically. Healthcare really is local. If you have an idea you'd like us to address, please subscribe, like, or share. And if you have any questions, email them confidentially to questions@cubed.org. Stay tuned for our next educational video.